forward to further accelerate our path out of this pandemic.
Now, parents can kind of take a collective sigh of relief and say that they are able to provide that same protective factor to their children.
Today, she's just like, I'm so excited, let's do this.
That's great. Now I know my body is strong enough because I have the shot now to take off your mask without wearing it.
The president, physicians, and parents are ready to vaccinate children ages 5 to 11. But amid the excitement, many families still have questions about vaccine safety. Good afternoon, I'm Kate Larson. Because of those concerns, we are dedicating the next half hour to answering your questions about vaccines and your children. I'm part of the ABC7 News vaccine team, and we continue to focus on getting answers about all COVID vaccines. And joining me today is another vaccine team member, ABC7 News contributor, Dr. Alok Patel. Along with Dr. Patel, Kimmy Watkins-Tart, Director of Alameda County Public Health and licensed marriage and family therapist, Ann Parsons with UCSF. Thank you all so much for joining us. And we're going to hear from our panel of experts in just a moment. First, some important numbers. Since the pandemic began back in March of 2020, there have been 1.9 million COVID cases among children ages 5 to 11. According to the CDC, 8,300 have been hospitalized and at least 94 have died, making COVID the 8th leading cause of death for that age group last year. Now, in the last few months, we're also seeing an uptick in cases among that group. As of last month, children 5 to 11 made up just over 10% of new COVID cases, the highest percentage for that age group since the pandemic began. We know you have a lot of questions about the vaccine, so let's get right to our panel. Dr. Patel, as alarming as those pediatric COVID case numbers may seem, children 5 to 11 only represent about 4% of total U.S. COVID cases, which obviously represents a much lower risk compared to other groups. So given that lower risk, do you feel and advise that parents get their kids vaccinated as soon as they can?
Kate, I do. And, I understand that there's two big metrics out there that a lot of people focus on. And number one is that death number, which is around 100, and the 4%, as you mentioned. But two numbers that I really try to remind parents about when we have these direct conversations is, number one, the unknown number of how many cases have been transmitted from this age group as well, because they can still transmit the virus, even if they have no symptoms or they have mild symptoms, but also the undocumented amount of long haulers out there. So kids who are age 5 to 11 who may persist and have things like fatigue, headaches, shortness of breath for a long period of time after their initial infection. And I have to be honest, they can have an asymptomatic first case, just a positive test, and then develop long COVID later on. And so it's a multitude of reasons why I implore all parents to get their kids vaccinated. And if parents have questions, great, ask those questions, be an empowered parent. Just make sure you're getting all your information from a good, credible source.
I think that's a great point about long haul COVID, Dr. Patel. Nobody wants to see their kids sick, much less sick for the long haul. I want to ask the next question of Kimmy, who's the director of Alameda County Public Health. When it comes to vaccine availability, what are you seeing right now in Alameda County? Obviously, we've had really high uptake of vaccines in the Bay Area in general. How is it looking for this age group?
So we're really getting off to a great start here in Alameda County. Many of our pediatricians already are set and have started with their vaccines. For the county-sponsored vaccine clinics, we are expanding our services. We're partnering with the Alameda County Office of Education in order to establish stable site clinics within 9 priority school districts, as well as we will be expanding our mobile vaccination effort that will have vaccine clinics in and around school sites at the neighborhood level. Our aim is to make sure that families and parents, they have access to vaccine wherever they need access to be. We are also really encouraging families to use their normal healthcare provider to also get vaccine.
Kimmy, do you know if there are actually appointments available right now? We just heard from reporter Cornell Bernard that in Marin, the clinics set up through the schools are totally booked this weekend.
Right. So it really depends on the provider. All of us are getting off, to a relatively good start, but each provider is really different. For the county-sponsored sites, we won't be ready until about the November 18th, but there are some appointments available with medical providers, but you would have to really go to your medical provider to see if you can get an appointment there.
Okay, thanks for that. And Anne, who's a family therapist, what do you want to say to parents who are worried about the vaccine for young children, or children who are worried about getting that shot?
Sure. The first thing I'd want to tell parents who might feel worried is that it makes sense. It makes perfect sense for parents to feel concerned. People worry about the things that we value the most. So the things that are most important in our lives, we're going to have the most worried thoughts about. And what's more important to parents than their children's health. And then I think the content that we've been, we're talking about, which is COVID, is extremely relevant because parents are ready. It's been 2 years, but thematically, what's also important is that parents worry whenever they have to make an important health-related decision for their children. So I would acknowledge that parents are probably having very mixed feelings. And if they continue to have thoughts or questions, that get a little more insight into what they might want to ask their pediatricians to get some more clarity on that.
Okay, thank you so much for that, Anne. We still have much more ahead, a lot of topics to cover, and of course, we want you to join the conversation, so go to Facebook or YouTube to weigh in and get your questions answered. We're going to take a quick break here on TV only, but we'll still be live on Facebook and YouTube, so stick with us. All right, we are live online right now. Dr. Patel, I want to ask you this question. What are the biggest myths that hold parents back from getting their kids vaccinated, or maybe even getting themselves vaccinated, that you want to dispel?
Oh man, this is only a few minutes, Kate. I need like an hour and a half to talk about this. But I'll keep it clean. So we've heard about a lot of the myths regarding the vaccines broadly, but I'll narrow down the ones that overlap with the concerns about getting young kids 5 to 11 vaccinated. The first one I hear is that the vaccine doesn't work, which that's completely untrue. We know that it works extremely well. It's among the most effective vaccines we've ever seen in history. Another important, myth I want to dispel is when parents say kids don't need it. We kind of addressed this in the first block of the town hall, but kids absolutely do need it, not only to prevent hospitalizations, deaths, but the long COVID symptoms, and also to prevent transmission. But Kate, there's a couple of other ones out there, such as, this vaccine could potentially cause infertility or mess with a child's development. Neither one of those have any evidence at all to back those claims. And then the number one that I'm hearing right now from parents who are actually doing their due diligence and reading up is about myocarditis and heart inflammation. And the fact is, across multiple studies, that myocarditis, you're more likely to get it from COVID-19 itself than from the actual shot by multitudes.
The number one thing that I hear when folks are hesitant, Dr. Patel, and we've only got about 40 seconds left, is, but we don't know what the long-term effects, we don't know how this will behave in our children 10 years from now. What do you say to parents who ask you that?
I think it's an important one because it does play into the development and the fertility topics. And I tell parents, 99%, the majority of adverse reactions to a vaccine are going to take place in the first about 6 weeks, which is why an emergency use authorization takes 2 months to actually get that safety data. And we already have that. We have more than that. And remember, after the mRNA is made and your body makes that spike protein, this mRNA disappears. It's gone. There's no trace of the vaccine anymore.
All right. Thank you. That's it for us online. We're going to head back to TV in just a few seconds.
I want to get the vaccine for everybody.
I don't like shots as much, but I want to protect myself.
I'm just happy. I feel excited because now that I'm one step closer to getting fully vaccinated. I felt very nervous, but now it's over, and now we're vaccinated. That's a big step into making the world normal again.
Courage, reaction from some of the first 5 to 11-year-olds across the country to get vaccinated this week. We are back with our panel, and I want to go right to Anne since we heard from those brave children. What should parents tell their children if they're nervous about getting the shot? And at what point do you just have to give your kid a bear hug and sort of hold them down for the shot?
All of the above. It's really heartwarming to hear those children react to their vaccines. I think first and foremost, parents just need to talk to their children. Occasionally I've heard questions like, should I not tell them? And the most important thing to do is plan ahead, talk to your kids, ask if they have any questions or if they have any fears. Sometimes kids can have fears that parents don't really anticipate, like, is my arm going to be sore and I won't be able to throw the baseball? Hopefully parents already have language established with their children about why we're having the vaccine, because they've had experience with early childhood vaccines and seasonal flu vaccines. But I think parents can, assess and see what children are thinking about it, and then add some realism to it also, which is it won't last long. There's probably going to be a lollipop after this happens. And there's going to be some really good things at the end of the road because of this.
All right. Thanks so much, Ann. And Dr. Patel, this is sort of a question we've been talking about for kids who are on the cusp of 11 or about to turn 12. What about the second dose? If your child is 11, do you get them the pediatric dose now? And for their second shot, do they get the adult dose, or can families choose?
This is a good one, because there is that little shade of gray. So according to the American Academy of Pediatrics, if your child gets their first dose at age 11 and then is going to turn 12, you stick with the earlier dose. So stick with the smaller one. If a birthday is coming up relatively soon, let's say within a few days or a week, it's okay just to wait or talk to your pediatrician about getting the higher dose. But if you're like, hey, my kid's going to be 12 in 6 months, just go ahead and stick with that smaller dose. Because the important thing that people should know is that this test was studied between kids aged 5 to 11, and that smaller dose, the one that's 10 micrograms, showed a robust response. Those kids got as many antibody levels as those kids who were age 12. So I don't think parents should worry too much about this fine line. But as always, when in doubt, chat with your pediatrician, pharmacist, nurse practitioner, any health professional around you about this.
Yes, ask your doctor always. All right, Kimmy, the last time you and I spoke was after a town hall about vaccine equity with Black women organized for political action. And, parents are, of course, making the vaccine decisions for their children. So how, in places like Oakland, with existing health and vaccine disparities, do you plan to make sure everyone has not only access to the shot itself, but the best possible information to make an informed decision?
So as you mentioned, we've been really concerned about vaccine equity and the disparities here in our county. And so we will continue the strategy that we've been using all along, and that is to partner very deeply with community-based organizations, grassroots organizations, residents in the community, trusted messengers, to help us to get the word out, help us to engage parents, help us to encourage parents to lean in and ask the questions that they actually have right now about getting the vaccine. We're also hoping to partner more with medical providers to encourage parents to ask questions and to get the information that they need from those physicians or mid-level practitioners that they have trusted with their children's health pre-COVID. That part is really important. In addition, we are starting here in Alameda County some doc talks, where we are working with our partners at Children's Hospital and at Sutter to engage in conversation with parents about the vaccine to get those questions answered.
All right. Thanks so much, Kimmy. And I know you guys are going to be working really hard to make sure that everyone has equal access in the community. Such an important point. Dr. Patel, we do have a question from a viewer who's really curious about when the Moderna vaccine might be available for children 5 to 11. They're a few weeks, months behind Pfizer traditionally through all of these trial steps.
Well, we don't have an exact time yet of when Moderna is going to submit that data to the FDA for an EUA, but the good news that just came out, I believe on the 25th of October, is Moderna did release kind of an early cherry saying like, hey, the trial on those kids aged 6 to 11 showed a great immune response. And that early trial data that they released not only showed that there was a good antibody response, but that it presumably was safe. Now, there's nothing else that we can really say about this. If you remember, Pfizer released an initial statement like this as well prior to them submitting data. But the underlying thought is that it might be a couple months away before Moderna actually submits that, and then the entire process has to go through again. And so, this might be something important in areas where there is a supply issue or parents want more options. But I think the important thing kind of goes back to just making sure that we have equitable distribution. We have distribution for all parents, all kids, everyone out there right now, including worldwide distribution also, which, we talked about this a lot over the last year regarding the vaccine for older kids and adults, and that has to be an important priority for younger children as well.
And one more question, Dr. Patel, and we spoke about this online during the break, but I think it's really important. A lot of the questions that I get from parents are, but I don't know because we don't know how this might affect my child 10 years down the road. We talked about dispelling myths. What do you say to parents who ask you that question?
Well, the first thing I do is I have to acknowledge that it is a real concern. It's a real question. I understand why parents have it. And then we walk backwards and we talk about the way the vaccine actually works. Remember, the Pfizer vaccine, you're going to get that little mRNA kind of blueprint, makes a spike protein so your body can recognize SARS-CoV-2 in the future like a wanted poster. But in this process, the mRNA disappears. It's gone. And unlike what misinformation says, it does not alter your DNA. The mRNA is not going to go into the nucleus, the powerhouse of your cell, and change things around. It's not going to happen. So there's no actual science or evidence to back the fact that this vaccine can affect a child's fertility, long-term growth, or anything in that sense. But unfortunately, we don't know about the long-term effects from COVID-19 itself. So if parents really want to protect their kids against something that could affect them in the long term, protect them against the actual virus we're all fighting, COVID-19.
Great information, as usual, to our whole panel. Thank you so much for sticking with us. We're going to take a quick break here on TV, but we are going to be on Facebook and YouTube, so stay with us. We'll be right back. All right, we are live online. Kimmy, I wanted to circle back about the quick conversation we were just having because you said something to me a couple months ago that really resonated. And you said we don't always vaccinate a lot of people, but when we do vaccinate people or when we do reach people, we vaccinate 100% of them. Can you explain that and sort of how that will play into your efforts with reaching families with young children?
Yes. So at the beginning of our vaccine distribution, we saw long lines, lots of people coming to our clinics to get vaccinated. And as the months went on, the numbers got smaller and smaller and smaller. And because of that, you might think, well, is it really worth it to stand up a whole operation in order to vaccinate maybe a handful of people? And so what we see is that even though the number of people that we vaccinate with our mobile sites or even with our homebound work that we do where we actually bring vaccine into a person's home, the number is small, but it's 100% of who we were looking for. It's those kinds of efforts where we are using a very small operation, going exactly where people are who we know are unvaccinated. Those efforts have been very successful for us.
All right, thank you so much for that, Kimmy. And Anne, I want you to weigh in. What are you hearing from families that you speak to through UCSF or otherwise?
Sure. I have the fortune of working with children and teens, adolescents, kind of along the age range. So from the preschoolers up to 18. Honestly, I hear a lot of excitement, and I've gotten to see the effect that's happened with the 12 and older since they've been vaccinated and been more free to socialize, re-engage, feel more comfortable in their classroom. And it's improved that feeling of isolation. So what I'm hearing is an overall hopefulness.
Okay, thank you so much. That was such good timing, Anne. Great job. We'll be back on TV in just a few seconds.
The trials for kids under 5 have been underway, and we anticipate that in early 2022 is when we may see a vaccine available for kids in that range.
That's U.S. Surgeon General Dr. Vivek Murthy on the next COVID vaccine stage, shots for children under 5. We are back with our panel of experts today. Dr. Patel, what are you hearing about the trials for kids 5 and under? A lot of folks with babies and toddlers want the shot too.
That's exactly what I'm hearing, what Dr. Murthy was just mentioning, and also what you mentioned, that a lot of parents out there are like, oh my gosh, my kid is 3, like, what are we gonna do? And there's two things to address here. Is that number one, I hope everyone takes some reassurance out there in realizing how systematic this process is and how this already is the most studied vaccine in history in terms of its safety and efficacy and how much data people have combed over. And they're doing these separate trials for different age groups because children are not just smaller adults. And this is not just based on body weight. This is based on the immune response. And so we're using a 10 microgram. I shouldn't say we, but the pharmaceutical companies are using a 10 microgram vaccine for the age 5 to 11. It's even smaller. 3 micrograms are being tested for younger children because they absolutely want to make sure that this vaccine is not only going to be effective in this age group, but the side effect profile, the immune reactogenicity throughout the $1 million term is actually going to be a favorable one, these young kids as well. And I understand why parents are concerned because guess what? Even though cases are coming down, we don't know for sure that they're going to disappear. There could very well be another surge after the current one right now.
Thanks so much, Dr. Patel. And I'm sort of curious what you think. Do you feel like there is more anxiety for parents the younger their kids get? What I often hear from parents in the younger age groups, under 5, is I want to get my kid vaccinated, but I don't want to be first in line. We'll do it, but maybe not right away.
That might be the case. I think what I can speak to more is parents who have had their kids vaccinated. So again, the 12 and older group. Have reported that mood has lifted, just engagement in their social circles have improved. And overall, I've heard that everyone's been really pleased with the lifestyles that their kids have gotten back.
And Kimmy, what do you think? What are you hearing in community and in Alameda County from the folks who live there and are looking forward to a vaccine or maybe just aren't so sure yet?
Some of the same questions. People have very logistical questions around, is it 1 dose? Is it 2 doses? How far apart? How much vaccine? If I have the child who's 11, about to turn 12. These are some of the questions we're hearing. We're also hearing questions from families who themselves have not yet gotten vaccinated, that they are uncertain if they will take that next step to vaccinate their entire family. And so we still have relatively large numbers of 12 to 17-year-olds in the African-American community, adults in the African-American community who are still unvaccinated. And so we will be working very closely with community partners and pediatricians who serve large numbers of African-Americans to really invite African-Americans in to ask more questions, to be able to turn that corner, to get comfortable, get the questions answered that we have, and to turn that corner. Because I do worry that the numbers of 5 to 11-year-olds in the African-American community might be even smaller than what we're seeing right now with the 12 to 17-year-olds if we can't get African-American families and communities comfortable with this.
Absolutely. Kimmy, thank you so much. We do have some more viewer questions coming in. Mark asks, for kids who have special needs or medical conditions such as autism or cerebral palsy or PTSD, how will they be able to get the vaccine if they are unable to go to clinics or pharmacies, especially if they're homebound? I'll let anyone answer that question. Dr. Patel or Kimmy, you might know.
So here in Alameda County, we provide vaccines in the home. And so we would love to serve anyone who is either homebound or just prefers to receive the vaccine in their home. But we do prioritize those individuals who can't really easily get to a clinic or get to their doctor's office. And so we would love to be able to serve anyone who wants a vaccination in their home but cannot leave.
Okay, thank you so much for that really important information. We're going to take a quick break here on TV, but we will continue on Facebook and YouTube, so please join us there during the break. We'll be right back. And we are back online. And this question sort of comes from recent personal experience. I have a 4-year-old. We went for her checkup, had to do a flu shot and one of the childhood vaccines. And she's old enough to be scared. She's a little bit dramatic, not going to lie. We had to get in an extra nurse to come help hold her down. What's your advice? Is that the appropriate thing to do? Or do you just say, we'll come back another time? How do you make this as smooth as possible for little ones who really are afraid of those shots?
That's hard to say because there's circumstances where you can't always come back another time.
Right.
For parents in your shoes who know ahead of time that there's unease or distress, what I'll often suggest is to do something like a cope ahead plan, where the child can have some sort of involvement in the planning of what it's going to look like, so they can help decide maybe the shoes they're going to wear, whose lap they're going to sit on, the flavor of lollipop that they're going to have afterwards, and also having something ready like a self-soothe kit, which you would include objects that essentially help to encourage mindfulness. So like a tactile object the child might be able to hold, a stuffed animal, something like a sour gummy that they could put in their mouth that might redirect their attention for that moment.
I am taking notes because I'm going to use all of those tricks the next time my kid gets a vaccine. I also think it needs to be done quickly. There was like way too much anticipation, and it just gave her more time to get worked up. So maybe advice on trying to get it done quickly, distracting, and then just get the shot.
Okay, can I just add one thing?
Yes, please.
I totally agree. I think it was amazing what Anne was saying about like kind of creating the coping plan. The other thing that I've heard parents tell me they've done, and depends on the kid, is actually explaining to the kids age appropriately what it actually means to get vaccinated, what that will do for their body, and how it protects people around them. And kids are amazing. They embody this like public health superhero spirit. And I've seen some kids understand why this needle is coming to me, how it's going to get me my old life back. Let's do it.
I think that's really good advice too. Again, more notes being taken. All right, thanks guys. We're going to head back to TV. All right, we want to thank our panel of experts for taking time out of their very busy schedules today to answer your questions about the COVID vaccine and kids. Thank you to ABC7 News contributor Dr. Alok Patel, Kimmy Watkins-Tart, Director of Alameda County Public Health, and licensed marriage and family therapist Ann Parsons with UCSF. Thank you so much. Thank you for this wonderful conversation. We really appreciate you. Just final thoughts as a parent. My daughter is 4. All we want to do and all we can hope for is to make the best possible decisions for our children. And even for parents who are vaccinated themselves and see and support all of the science and data, there can be a different level of concern when it comes to their kids. We want to protect them. What I do know is every medical professional I've ever spoken to, including the wonderful folks you just heard from, are eager to have those difficult conversations with families and hopefully ease some of that anxiety related to COVID or the vaccine. So call your pediatrician or family doctor or someone you trust in the medical community to help make the best decision for your child and family. If you missed some of today's conversations, you can watch it again on our connected TV apps, Roku, Apple TV, Fire TV, and Android TV. Search ABC7 Bay Area to download it now. And of course, if you have any questions about COVID vaccines or policies, ask our vaccine team. You can go to abc7news.com/vaccine and click on that big blue box. You can also get more details about the rollout for each kid in each county. That's it for our special edition of ABC7 News at 4. Thank you so much for watching. We appreciate it. ABC7 News at 5 o'clock is next.